Hi, I'm Dr. David Dow, and we're here in our rehab area, and we're talking about the things that we do in the office to actually correct your back pain. And one of the exciting things that we're going to talk about today is called spinal molding. And when you go to the chiropractor can do an adjustment on your spine. When the bones shift out of place and put pressure against the nerves, that's where the pain comes from. The chiropractor does the adjustment, pushes the bone back into place, and that gets the pressure off the nerves so that your body can heal. Now, what we do in this office is we do exercises to help keep the pressure off the nerves for longer periods of time so your body can keep healing for a longer and longer period of time. Now, one of the problems and things that can happen is after an injury, you may lose the curve in your spine. Now, if you've been told that you've lost the curve in your spine, sometimes your doctor might say that it's not a big deal. What we learned in chiropractic is those symptoms that you're having come from that loss of curve, and getting the curve back in there gets rid of those symptoms and gets you feeling better. So getting that curve back into the spine absolutely will help with those symptoms that are happening. So one of the techniques we use to get the curve in there is first we'll do chiropractic adjustments, we'll do other exercises to loosen up how the bones are moving, kind of get the rust out of those joints. Once the joints are moving really good, we'll have the person lay over this device, and it's like an orthotic, like those shoe inserts that we use in our shoes. It's like an orthotic for the spine, and what that does is it pushes the bones back into alignment, and as we do that on a daily basis over time, it can put the curve back into the spine exactly the way we want it. Now, we will take x-rays in order to see what's going on with your spine, figure out where the placement needs to be. Also, we measure it specifically off of the x-rays. It tells us what size of an orthotic we need to use for your situation. And then we order them. They usually show up within about 2 to 3 weeks, and we can get you started on that spinal molding. But that spinal molding will correct that curve. And research has shown if you're using this device on a daily basis, everyone on average will get about a 13-degree improvement in the curve of their spine after about a year, and expect to get that year after year, as of course, until you reach your back to normal place. And obviously there's a lot that we need to do. This is very individualized, specific to every different person. We have these devices for the neck, for the lower back, for all the different parts of the spine. And using this along with the adjustment, it's like a perfect match. They work super well together. We're able to get and keep the pressure off the nerves for so long that often we'll see that the symptoms will go to the point where they can be completely gone. So we've had patients that have hit every single one of their goals that they've had in our office and actually been able to correct that. So we love being able to do that for our patients. We would love to be able to do that for you as well. And if that's something that you're interested in learning more about, check the box below and come in. We're going to do a thorough history where we listen to your problems and help to just thoroughly hear what's going on with you, do a thorough exam, check the nerves, see how they're working, and then we're going to do motion study x-rays so we can see what we need to do, not only with the spinal molding, but we can see which bones are moving, which ones are stuck, exactly what we have to do to get it corrected. And then we'll work together to create a plan that's specific to what you need to get these problems corrected. And that's what most people need in order to be a success in their health, is a solid plan to get there and work together with a mentor who can do that for you. So anyway, we've got more videos. If you haven't seen all the videos, keep track of those and you can watch those. And if you want to come in as a patient, check the box below. And thank you very much for tuning in.